ఇలాగా ఎసెన్షియల్గా చాలా మంది మనకి ఒకటి इको
जी सर।
जो बोल रहा वापस आ रहा
हाँ
क्यों ऐसा
ఎందుకు
18-20 minutes का 10 minutes आपको ये येलो लाइट है अच्छा वाइट लाइट अच्छा जी सर
Hello everybody, my friends. I am Dr. Sachin, oncology surgeon specialist in cancer treatment from Yeshoda Hospital, Hyderabad. Basically, I did my specialty from Mumbai. I was in Tata Memorial Hospital, and then I was in London for my FRCS, and I was in Singapore at National Cancer Center for the future options, treatment, prognosis, and newer modalities of treatment to deliver the best treatment in India. I want to share something, some good thing, bad things about cancer, some myths and facts about cancers. Because nowadays we see every day in and out in our family members, or maybe in our colleagues, maybe our friends or relatives and dear ones, somebody has been diagnosed with the cancer, and now what next? Because that situation I'm facing in day out, because every patient who comes to me, they have lot of doubts and queries regarding the cancer. First of all, let me tell you few facts about cancer, that it is universal problem, as it is the data in 2030 probably the cancer will be a number one killer for all human beings. There are so many causes for them. We have changed from our lifestyle, addictions, tobacco, gutkhas, and maybe the fast food what we are eating, the oil and vegetables what we are eating, and important is family history. So all those things matter for the incidence of cancer. And believe me, in other diseases only the patient suffers, but in cancer, along with the patient, his family, his relatives, and his everybody along who are along with him, they also go through the long journey of cancer suffering and the treatment. Because unlike other disease which maybe for few days the surgery or the treatment will be over, but the cancer can take a long time for the treatment. Patient has to go through the surgery. Some patients may require chemotherapy, radiation, and other hormonal therapies. And one survey was came in Economic Times of India, where they have mentioned that to treat one cancer patient it requires approximately 3.5 lakhs rupees. So it is not very easy to generate that much amount of money for the population of India, who has 70% of middle class families are there. So why not to take care before it comes? A stitch in time prevents 9. So the crux is, if you catch it young or if you prevent it, that is the best possible solution for this answer. So cancer can come to anybody. There are celebrities, there are poor people, there are rich people, there are females, males, kids, everything. It doesn't know any class, border, or any other religion. It can come to anybody and it can attack to anybody. So we have so many people who have gone through detected for cancer, who have gone through the long journey of cancer, and they have successfully came out and they have started their own new life from the treatment of cancer. So most of everybody asks, Dr. Saab, what is a cancer? So cancer is nothing but it is proliferation or increase of the abnormal cells in the body. See, God has given or nature has given every cell of a body has some lifespan. For example, our red blood cell will live for 120 days. If it doesn't live for 120 days, it may not die on around 120 days. It just keep on prolonging the cell herself plus 1 to 2. It also reproduce from 1 cell to 2 cell, 2 to 4, 4 to 8 and so on, and that forms a tumor, and it spread to the other organs, that is called as metastasis. So that is the cancer. It can happen any part of our body, right from intestine, liver, kidneys, lungs, breast, and all organs can have a cancer. And then the next question they ask, these are all frequently asked questions which my patients ask to me, which my relatives ask me. So I'll just brief about those things. So what are the etiological factors? Why it comes? So it has so many etiological factors. It has multifactorial. There is no one factor can cause cancer. So it is from family history. Say your mother, father, or somebody elder generation have some kind of tumor or cancer, that you may have cancer maybe around 3 to 10%. Second thing, our lifestyle, as I told you, what we eat you have to observe. Just don't go with your taste buds. Avoid the oily food, avoid the food which has spicy items, and take healthy foods like vegetables, fruits and all. Third important thing is our addictions. So many people in India are addicted to tobacco, smoking, and pan, and other drugs. So it is not good for health. Apart from the normal side effects, the important side effect is the cancer. And please don't try to engage in those activities. Or if you are smoking, if you are consuming tobacco, please quit it. So that is very important message I want to give it to you. And then there are so many chronic infections, so many hormonal imbalance in your body which can go for the cancer. And then the next question everybody asks, what are the stages? So in what stage is my patient is? Very important question. So by and large there are 4 stages of cancer, from stage 1 to stage 4. Stage 1 is, stage 1 and 2 are early cancer, stage 3 is intermediate, and stage 4 is last stage, where patient has already all the organs have been affected by the cancer cells. So here important is, as the stage is low, the chances of survival are high. Like if it's stage 1 or 2, the success rate from coming out of cancer is more than 70, 80, 90%. And if the patient is little advanced stage, then unfortunately there is nothing much we can do except giving him good quality of life, pain-free life, and treatment, palliative care. That means what patient has a problem, just treat it, but we cannot cure it. So the crux is, if the stage 1 and 2, if you have diagnosis done in stage 1 and 2, the chances of getting cure are very high. Then the next questions my patients ask or relatives ask is, okay, operation is required or surgery is required or radiation or chemotherapy. So what is all those? Nobody knows what is chemotherapy. Nobody knows what is the radiotherapy. So basically chemotherapy is injections of some higher powerful injections which kills the cancer cells. So and there are some side effects associated with this chemotherapy, because when the injections, the drug kills the cancer cells, at the same time it can kill your normal cells also. So your immunity goes down, you have your blood hemoglobin goes down, you are prone to some minor infections. So at that, and the lot of other side effects like hair loss and nausea, vomiting, and weakness, all are there, but they are minimum. Now it depends on the patient to patient how much that particular patient will have side effects. But now today's era, there are so many good molecules, so many good chemotherapy agents are available which are really specific effects only on the cancer cells. They only kill cancer cells and sparing the normal cells. So that is called as targeted therapy, or we have magic bullets in hands, which kills only the tumor cells. And apart from them, now we have good medicines available which can take care of the side effects, and believe me, the side effects are only temporary till the treatment is going on. Once the treatment is stopped, the chemotherapy side effects will automatically come down. And the second thing is the radiation. Yes, radiation is a powerful rays like X-rays which kills the cancer cells. So there are some areas in the body like brain, like lung, where we cannot treat or do operation because they are some important organs, and sometimes it is risky to operate there, or the patient is already advanced stage that we cannot do operation. In that stage we give radiation. Radiation is also had some minimum side effects like injury to surrounding structures. When the rays kills to the tumor cells, some scattering of those rays can happen and the surrounding normal cells can be also damaged, but that is also mild and temporary. And now we have so many good machines are available across the country, so that we can treat exactly on the tumor there with it is like a laser. So it is very pinpointed, and the surrounding side effects are less and with a good accuracy and precision. So that is about radiation. And the surgery are various types depending on the tumor. Say it's a breast cancer, so lung cancer or abdominal cancer. So different organ has a different types of surgeries that can be explained as case to case basis. And so what is to be done? The next question my patients or relatives ask, okay, I have suffered from cancer, but I don't want my other colleagues or my other people or my other dear ones, I don't want them to come or diagnosis of cancer or suffer from cancer. So in that, prevention is the key. So where it is prevention of chemical exposure, prevention of carcinogens, prevention of infections, prevention of radiation hazards, and very important is lifestyle modification. So all those things come under prevention. So I'll just brief about some important cancers, because 70% of the patients of ladies who come with me, either they are breast cancer or cervical or uterine cancer, and in gents or males it is oral cancer or lung cancer. So for breast cancer, there are so many risk factors like early menarche, late menopause, or previous history of radiation. And very too important I want to stress is breastfeeding. Always breastfeeding is protective. So sometimes younger generation, they try to avoid breastfeeding to their kids because of their cosmetic consciousness. But I urge everybody said that better to give breastfeeding to your newborns, because it will help to your newborn as well as you. And second thing, late first child, because today generation, as the ladies are involved in the education and jobs and their other priorities, the marriage and the first childbirth is delayed. So as the childbirth delays, the chances of having breast cancer are more. And one more thing, what are the signs of the breast cancers? So any lump in a breast, usually more than 40 years of age, is little suspicious. But I am not frightening you. Out of 10 breast lumps, only 1 is problematic and 9 are benign. Benign means non-cancerous. So don't afraid, but just take care that if you detect any lump in your breast, any nipple discharge, any swelling in the axilla, just to show to your oncologist or gynecologist. And then we do some mammography which detects a breast tumor. It is like X-ray of breast, where it takes the images of the tumor, and then we can do some biopsy or FNAC to confirm the cancer. And then we do some test like CT scan or PET scan, where we rule out the distal metastasis. For example, whether it has spread to lungs or kidneys or liver, we just rule out and we confirm the stage, either stage 1, 2, 3, 4, and then accordingly we plan a surgery or chemotherapy or radiation. So what are the ways to prevent breast cancer? So these are breast self-examination, annual mammography, and clinician breast examination. So breast self-examination, something I want to tell you, all the ladies who are more than 40 years of age, just take care, just palpate your breast on the 10th day of your menstrual cycle and see whether there is any abnormality, any lump, any nipple discharge, and just report to your doctor, as well as do annual mammography after 40 years, and clinicians visit every yearly. And second thing is cervical or uterine cancer. There are various risk factors, but the signs of cervical cancer are intermenstrual bleeding or postcoital bleeding or postmenopausal bleeding and some infections. So if you have something like that, better to see. We just do pap smear. That is something called as we take some cells from the cervix or uterus and we test it under microscope and we do diagnosis whether it is normal or abnormal. If normal, no problem. If abnormal, you need consultation and further treatment. And then what are the other warning signs of cancer for all over the body? So any change in your bowel or bladder habits, if you have altered bowel, diarrhea or constipation, or if there is bleeding from rectum or urine, please consult doctor. It is not good. Those symptoms are not good. Second, any breast lump. Third, any nagging cough which is not responding to your normal treatment. Any sore that does not heal, maybe in the buccal your mouth cavity, your tongue, your lips, or maybe any part of the skin. Any ulcer which is not healing, that is not good. Then if you have change of voice, difficulty in swallowing, dysphagia, please report the doctor. So all these things are these are danger signs. You have to take care. You have to immediately report. And then what are the risk reductions? Like everybody has a risk because we are living in urban area where there's so much pollution, where there's so much fast food available every nook and corner of the city. So how to prevent the cancer? So in that, eat plenty of vegetables and fruits and raw fruits. Decrease eating animal fats and non-vegetarian diets and fatty acids. Avoid excessive weight gain because obesity is very important risk factor. Then avoid consumption of tobacco, alcohol, gutkhas. Avoid midday sun, and avoid the carcinogens if you are working in some environment like rubber industry, plastic industry, and some other chemical industry. And very important is screening. Screening is something like we do some regular test irrespective of your health. Even if you have normal health, like you are checking your blood pressure, like checking your diabetes or checking your cholesterol, in the same way there are few tests available to check whether there is a cancer is there or not. So that is called as screening. So for breast cancer, it is annual mammography. For cervical cancer, annual pap smear. Then for gents, for prostate cancer, there is blood test available, prostate serum antigen, which can be tested on the blood. And for gynecological cancer, ovarian cancer, there are also blood tests like CA125. And for colorectal, that is intestinal cancer, you can do your endoscopy or colonoscopy to rule out any pre-malignant lesion or polyp or cancers. So as you do your servicing of your car every 3 monthly or every 6 yearly or every annually, you have to, because you have to give justice to your body. After all, your body is also one machine or one vehicle. You have to take care of it every yearly. You just do your checkup, including sugar, blood pressure, thyroid, calcium, along with some cancer test. So these are something guidelines which we follow. And very important, not last but least, is exercise. Minimum, it is not I am saying that you should do exercise, but it is our research or it is our literature says that every day 20 minutes of exercise at least 5 days a week is very good. Because for if you do exercise for 20 minutes, rest of the 24 hours your body will be active and it will provide surplus oxygen to body, and oxygen is something which is oxidant and that can reduce your cancer incidence as well, and protecting your heart, protecting your lungs, and protecting all your body, because exercise is very good therapy which really requires motivation and some company, and you should promote yourself to do regular exercise. So I think this information is sufficient enough, and if you require any particular help from my side, because this is something like a bio war. Now today's era, people will not die because of some nuclear war or some because of other issues. People will die because of these non-communicable diseases like blood pressure, hypertension, cancer, diabetes. So we have to take care of these things, and we have to everybody will go, the one who has born will be going to die one day, but and everybody will grow, everybody will getting aged and senior citizen. But it is very important that you should be healthy aging. It should be healthy aging, so that you can take care of yourself. You should not be dependent on others, and your old age should be very peaceful without much visits to any of the hospitals. So these are something where some my knowledge or some my thought which I wanted to share with you with this print and electronic media. And if you require any more help, please do not hesitate to contact me. My name is Dr. Sachin Marda. I am a consultant oncologist. My mobile number is 7702030101, and you can write me or pen down your queries to my email ID sachinmarda@gmail.com. Thank you very much.